Good morning. Well, it's a Friday. Good morning. No, good morning. Welcome to Still Up with 6. Chris is joining us from home. Hey there, Chris.
Hey there, Heidi. Good morning to you. Yeah, we made it through another week together, all of us. Those of you joining us and our Texas Today team as well. We're still here to answer your questions at home. We know that so many of you have questions. And I do want to remind people that just because it is the end of the week, that doesn't mean our work is over. You can always email me anytime during the weekend if you have questions that you see pop up. I will be working all weekend long to get you the truth about things that you're seeing online as well.
Yeah, and be sure to tune into the weekend edition because Chris will be there to be verifying some new claims. Of course, as we do every single morning, we want to start off with the latest numbers. I want to give you guys a local update here on the numbers. So Bell and Brazos County both have 5 new cases since we last checked in. There are now 5 cases in Bell County. There it is on your screen. 2 people have recovered, making the total to 12 recoveries so far. Brazos County is up to 68 cases, and they have reported 1 new death related to the virus. 3 are in the hospital this morning, and 3 have recovered. And then in McLennan County, you can see there 4 out of their 6 patients are in critical condition at the hospital. Meanwhile, there are 49 cases, and Lampasas is reporting its first case. As of yesterday, in McLennan County, there was only 1 new case. So that is the latest numbers here locally in Central Texas.
Yeah, absolutely. And I want to real quickly go through my Verify today. If you weren't able to catch up with Fast Friday today, I answered a bunch of questions that you had been sent me throughout the week. The first one, are these stimulus checks that we're expecting to come in over the next couple of weeks, are they an advancement on our next year's taxes? Will they be deducted from our tax refunds? We told you the answer is no. This is essentially free money, yours to keep. Another thing that has been coming into my inbox constantly since the beginning of this pandemic, people wondering if it's risky to pet animals. Is that a high-risk area to contract the disease? We can tell you that according to our experts, the ones that we talk to with the American Veterinary Medical Association and the CDC, pet fur is not a great environment for carrying the virus, so it's not high risk whatsoever. And finally, a couple of you heard that the deadline to file taxes has changed. We can verify, yeah, the new deadline to file and pay 2019 federal tax returns is now July 15th.
Another great edition of Verify, answering some really important questions. Of course, I had a lot of questions myself about the pet situation and if they can contract it, if they can spread it. If you have a question in mind and you want it verified, there's all the information on how you can contact Chris. It's listed on your screen. And of course, Chris, again, like we mentioned, will be working throughout the weekend, so be sure to send him your questions. I want to talk about our talker of the day today because it's really interesting, and I think a lot of people will have a lot to say about this. Laredo City Council has made a change this week. They are asking all their residents and requiring them to wear some sort of face mask, bandana, scarf, or fabric to cover up their nose and their mouth. And if people don't comply with this new ordinance in place, they could be arrested, they could face a fine. And we asked this morning if people think that everyone should be required to cover up their nose and their mouth with some sort of mask or bandana or fabric everywhere, and a majority said yes. And it's really an interesting thing because I actually want to say that I did go to the local Target yesterday. I needed to pick up a few things, and they're doing a great job over there keeping everyone safe, but I saw a lot of people already doing this. I know, Chris, you haven't really left your house in the past couple of weeks, but I will say people are really taking precaution these days, and I'm seeing more people covering up their face and nose.
Yeah, it's interesting, Heidi, because when this started a few weeks ago, the CDC came out along with top medical professionals and said that if you're healthy, it was not advised to wear masks. That dialogue has now changed. They are advising people to cover their mouths with anything they can get their hands on, whether that be a bandana, a scarf. But this is just an example, Heidi, of one of those things, as the information changes, as the things that we are learning changes, as the spread continues, one of those things that now health professionals and the CDC are kind of backtracking on and walking back on, now advising that you should be wearing masks in public.
Melissa says, who's going to provide the masks for people to wear outside? We have a bandana, LOL. That could be useful. They're saying that, you know, any sort of fabric to cover up your facial area here is useful. And of course, Chris, like you mentioned beforehand, a couple of weeks ago when this pandemic first kind of became an outbreak, you said that you were getting questions about the face masks. And it's really important to note that things are changing, right? Every single day you're learning new things, especially through Verify. The CDC is putting out new guidelines, new requirements. So things are changing on a daily basis.
Yeah, absolutely. I want to address Paul's comment here. He said, I guess we don't need to make N95 masks anymore if a bandana works fine. That is not the case. We need those N95 masks, particularly in our hospitals and our doctors' offices. So our medical workers need those N95 masks. Now, what we're saying is the N95 masks work the best in order to stop the spread. But obviously, access to those is very, very difficult. So top officials now saying that obviously most people don't have access to N95 masks. So covering your face with whatever you have is the second best option, but certainly still nowhere near as effective as an N95 masks.
And Nina says it's good to take precautions, but you can still be infected while wearing them. That is a good point. Of course, touching surfaces as well. That's why you're seeing a lot of people put on gloves these days. Those are two things really hard to find in the store, and I completely understand that. I'm having trouble myself finding gloves. So, you know, there is a shortage, but if you can't take the precautions, we have to do everything we can to stay safe. Tamara saying should have been wearing them all along. So she's saying that this is something that should have been implemented from the get-go. And of course, that's something that, you know, is out of our control. But we do want to remind people to cover up, even if it's not a city ordinance.
Yeah, and Heidi, let's talk about employment, money. I know that's a big concern right now. Of course, shocking new numbers coming out about unemployment, almost doubled since the last time. Some 6 million people now filed for unemployment. A lot of questions about when relief will be on the way. The White House now saying they are trying to rush that. So for small businesses, loans will be available. And of course, those stimulus checks hoping to be on the way within the next week or so as well.
And of course, we do want to give you the updated numbers. Nationwide, 6,000 people in the U.S. have died from the coronavirus. That's the latest numbers coming in. There are more than 1 million cases worldwide. But it is important to note something. We do want to shine light on this. 9,100, so 9,100 people have recovered from the coronavirus in the country. So we are seeing people recover, but of course we are seeing more cases as more people are being tested, and we are seeing more deaths as that death toll continues to rise. So those are the latest numbers coming in nationwide.
Yeah, absolutely, Heidi. And as we go deeper and deeper into this pandemic, we will start getting more numbers when it comes to recoveries. I know that's something that a lot of people here have asked about. Why don't we report as many of the recoveries as we do of the new cases? Well, now as we start moving towards, we're deeper into this and tests have been distributed and some time has passed, we'll be able to report more on the number of recoveries as well. I know that people think that oftentimes we focus too much on the negative, which of course is the death tolls, but now we will be able to start reporting on recoveries as well.
There is something to note, too, for a lot of people about the recoveries. When early on we were getting numbers and cases, especially here locally, people were asking, how come we're not talking about the number of recoveries? Well, we have to remember how long it takes to recover, just like how long it takes to show symptoms in the first place. So that's something else to keep in mind as we will continue to report the numbers each and every day.
Yeah, absolutely. And I can see a lot of people here talking about large groups of people going to stores. Of course, the president of HEB came out yesterday and advised to only send one family member to the store if you can. I know that childcare is a big problem for a lot of families, but if you can just send one person from your family to the store, that's obviously the advice that all top medical professionals as well as the president of HEB is saying as well.
Yeah, it's really important to remember that, right? I know, you know, going to the store as a family used to be something that we could all do, but now you have to think about the risk you're putting yourself in and others around you. So if you can, you know, it really upsets me when I am at the store and I see a family, because I think to myself, well, you guys could have stayed home. You know, one person could have watched the kiddos, and I understand there are certain circumstances where you can't do that, and that's understandable. But if you can, please just send one person out to the store. The whole family does not need to make a trip out of it. I know it's hard staying at home the whole time, but take a family walk perhaps instead of going to the store.
I want to point out Mindy's comment. This is a very important one. People should also stop buying the masks we as healthcare workers need that are on the front lines. We are having to use our masks for a week at a time for multiple shifts because of the shortage. Not safe. Citizens should use homemade masks when you have to be out for essentials and otherwise stay home. Very, very, very good advice. Very important, Mindy. If there's access to those N95 masks, of course, we hope that those are going to the healthcare workers who are in the most dangerous situations right now, around the sick people in the epicenters of where these people with the disease have to be right now. So that is very important. Those N95 masks should be saved for our healthcare workers, as there is a huge shortage right now.
That is a good point, yeah, and we want to thank all our healthcare workers who are working so hard during this pandemic. Of course, this is, I can't even imagine. I mean, Chris, you and I have talked about how we have to talk about this all day, every day for our jobs. Imagine having to be at the hospital treating patients, testing patients, helping patients recover. So we do want to say thank you so much from the bottom of our hearts to all our medical care professionals.
Yeah, absolutely. They are true heroes, and it takes a special kind of person, not just the nurses and the doctors, but of course people who are having to work in the administration area as well. So we want to thank everyone. And there's a debate about masks, that it has to be N95 mask, not regular mask. Okay, so here's what I can tell you to that comment, and that there has been some debate and some gray area. The N95 masks, which we are trying to get to our healthcare workers, those are the most effective in preventing and stopping the spread. A regular mask is obviously the secondary option, but since the availability of N95 masks is so scarce right now, a regular mask is the second best option.
Terry says, KCEN TV, please explain the difference in the flu and COVID-19. People seem to belittle the COVID with statistics. Terry, that is a great point. There are some different symptoms. We actually got to speak to a doctor about this. I believe we have that story online. Nick, I think, is running our comments section. If you can find that link and drop it in there, because there is a full explainer from a doctor about flu versus COVID-19. We also recently did a story, Maria Aguilera did a story about allergies versus COVID-19 symptoms, because they can cross each other, and you could see similar symptoms, but there are some differences and things to note. And we do have a full article for both those stories on our website, kcentv.com.
Yeah, and I would say to you, Terry, as well, the people that the big argument seems to be that, that flu is widespread every single year. The thing that we've been discussing here on the show is that the flu, we have an answer to that. We have a vaccine for that. Right now we have no answers as to how to stop the spread of COVID-19. So that is why COVID-19 is so much more of a dangerous situation than the flu. Amy asks, at what point, if you are sick, should you call into work if you have some of the symptoms but not all of the symptoms, and isolate even if you're not confident it is or is not the coronavirus? I would say in this time period, you'd rather be safe than sorry. I would say if you are showing any symptoms, you should stay home. And hopefully that your place of employment would be understanding of that, because if it turns out that you are just not showing all the symptoms, but you possibly could be positive, COVID-19 positive, you are putting people in danger. So Amy, if you're showing any of the symptoms, I would encourage you to stay home and isolate for sure.
And of course, for people who are wondering what those symptoms are, shortness of breath is one of them, coughing is one of them, a fever is one of them, a headache is one of them. So just be sure to stay home if you have any of those symptoms. Again, it's not just protecting you, but it's protecting everyone else who's around you or may come in contact with you. So that's something that you guys should be aware of, especially as we head on to the weekend. You can't go out, you can't do the normal, go to the mall, go to the movies kind of activities. So stay home if you are not working.
Yeah, absolutely, and we're finding out about different symptoms because this virus affects people differently. Certainly, we're now figuring out that stomach issues, upset stomach, diarrhea, nausea, those things could be possible symptoms. Now, an interesting one that we talked about last week is a symptom if you've lost your sense of smell or taste or both. That is an early indicator that you could be positive for the coronavirus. So keep those things in mind.
That's true. We want to thank everyone who dropped in the comment section and left us some questions. I hope we got to a lot of your questions and answered them, but if we didn't, again, you can still send them in to Chris, who will be working this weekend to verify more claims that you're seeing online. And of course, we will continue to check in with you guys on Still Up with 6 every single day next week, so be sure to tune into that. And as we do every single morning, we want to give you a reason to smile as we say goodbye. We've been doing these stories here locally. Today, my reason to smile story is my pup. He's actually live in studio. He is snoozing right now, as you guys can see, but he is my reason to smile. So I hope you guys find your reason to smile today.
Yeah, absolutely. We encourage you guys to continue to look for the positive, continue to look for the bright spots, the helpers, the good in all of this. I know that it's very difficult to stay positive, but we do encourage you to look for your reasons to smile. We will see you Monday morning here on Texas Today and Still Up with 6, 4:30 to 7 a.m.
And of course, you can always text this number, 254-859-5481, for the very latest on the coronavirus. As we say goodbye, one last look at our Louis Cam. We hope everyone has a great weekend.